All of us might be slightly depressed inside, whether it was due to COVID, past trauma, or losing a loved one. Depression is a common mental disorder affecting 3.8% of the world's population. More commonly affecting adults, children are also victims of depression. Characterized by feelings of sadness, loneliness, and loss of interest or pleasure in usually enjoyable activities, it affects how people think, feel, and behave. Depression usually varies from person to person. For some, it can be mild and temporary. For others, it can be so severe it leads to suicide. We know that depression is unhealthy, but what are some problems caused by depression? Suicide, self-harm, and other health risks are becoming increasingly common amongst adults, especially students, because they are uneducated about mental health and don't know how to deal with their depression. Other factors such as high expectations from family members, lack of emotional support, financial or academic struggles all cause mental health deterioration, causing people to lose their families, friends, jobs, and even their lives. We can help people by educating them on mental health, managing stress and emotions, teaching them how to care for themselves to hopefully make the world a happier place. In the United States, depression cost businesses $51 billion from employees missing work and another $26 billion from mental health treatments. Businesses who choose to monitor their employees for mental health and other treatments are more likely to incur in more financial burden. Long hours, unwanted jobs, harsh environments, and conflicts among co-workers are some of the most common reasons for employees to be depressed in their workplace, causing employees to miss work days, being less productive, and bring down other employees. To avoid losing money, businesses should create settings for their team that support the employees' health and happiness, such as valuing their skills, ideas, and talents that they offer. Appreciating them can improve engagement, productivity, and morale. Family members may feel frustrated and concerned when trying to support their loved one with depression. Communication can become strained, relationships ruined, and practical issues may arise. Taking the blame for the family member's depression because of guilt, not knowing the actual cause due to communication problems, may have an effect on the person's mental health, causing stress and maybe even getting depressed themselves. Communication is a key factor when trying to help with others' mental health. Have some empathy and don't judge them. Try to understand their situation and give them the proper help they need. Being mentally stable is one of the most important things in a healthy relationship. Depression often impacts the person's mood and energy levels, making the person mentally unstable and influence the people around them in a negative way. There are several variables that contribute to relationship depression. Negative thought patterns such as feelings of guilt or worthlessness are common and may affect how individuals view the relationship. One partner may have to put in more effort to support the other dealing with depression, causing stress and tension between the two. Trying to support your partner with depression can be emotionally draining, but you can't forget about your own mentality. Seek support from friends and family or get professional help. Depression can bring out the worst in a person, from health issues to unhealthy lifestyles. A study of over 10,000 young adults found that those with depression or poor mental health were 33% more likely to develop cardiovascular disease over a 10-year period. This is mostly due to people engaging in unhealthy lifestyle choices such as smoking, drinking alcohol, and lack of exercise. This causes people to experience more stress than average, which releases hormones like cortisol, which negatively affects our hearts and blood vessels. There are several ways to treat depression, including therapy, medication, and lifestyle changes such as eating healthy, exercising regularly, and to quit smoking are all important for helping with depression and reducing stress. Patients with depression are more likely to disrupt the country's economy. Depression can lead to decreased productivity, absenteeism, and increased healthcare costs. Some people suffering from depression have difficulties maintaining employment, which contributes to a decrease in overall economic output. According to a medical study from 1989, patients with depressive disorders tend to be functionally worse while their health was perceived to be on a decline and had greater bodily pain compared to patients with no such chronic disorder. When it comes to marriage, couples with at least one depressed partner are considerably more likely to divorce than those without a depressed partner. Additionally, a 2-year study found that ending a relationship was related with a 12% increased risk of a subsequent depressive episode.